breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison. What's going on, buddy?
Not too much. I'm excited for this one because this is devastating for so many people. So I'm glad to break down this topic that we're going to do today.
Yes, it really is. Can cause a lot of pain, a lot of heartache, and a lot of people are not overly familiar with what it is until they go to their primary care physician or they Google all their symptoms.
That's
so
correct.
If this is your first time watching or listening to the podcast/telecast and you found this information valuable, please hit like and subscribe, turn on notifications to get new information as it comes out to you, because you never know when we'll break down something that's pertinent to your health. So without further ado, buddy, let's get started. We're going to tell you about shingles today.
Mm-hmm. So
nasty bugger.
Nasty. And especially if it's reoccurring.
Oh,
it's reoccurring. So I know this is associated with a lot of neurological symptoms. So I'm going to get you jump into that. What are some of the signs and symptoms of what people would experience? And they're like, oh my goodness, what's going on in my body? What would they see? What would they feel?
So first off, shingles is actually a reactivation of a previous infection that you had. And it's really, really common. I had it. I'm sure you had it. I'm sure most of our viewers have had it. And that is actually chickenpox or herpes zoster virus. So what happens when you get shingles is you actually have the virus basically lies dormant in your dorsal root ganglia. And when it reactivates or becomes stimulated, it actually will travel.
That's the nerves. That's the nerves.
It's your nerves. And it can be present in any dorsal root ganglia. And it can follow any nerve dermatomal pattern. So basically when I say that, that means that the path that the nerve follows. So when it becomes activated, it actually follows that nerve out. And the signs and symptoms of shingles can be, like I just talked about, it can be pretty much anywhere, but you get like a tingling, burning sensation followed by itching. And then you get a bunch of blisters, fatigue, pain, musculoskeletal complaints, and fatigue and aches, just kind of nasty stuff. The most common place that I've seen it is on the rib cage. So it'll actually start in the back and follow its way around. But I have seen patients occasionally that have it on their face. So it'll follow what's called one of the branches of the trigeminal nerve distribution. So it can be here or here, up here, even into their eye occasionally.
Wow.
So it's kind of really, really nasty stuff, really painful and not very fun to experience.
Yeah. And developing into blister-like, symptoms, that is I think that's kind of the peak of the pain, right prior to the blisters. Mm-hmm.
Yep.
And and the patterns, you can Google this stuff. You can find dermatome patterns. Might give you an indication, a little bit of an understanding if that's what it is. I see like the risk factors with this is, I usually over the age 50, and I know we talked about it. I think you're even doing some research on that. Usually over the age 50, but it doesn't have rhyme or reason with it. I've seen people in their 20s get it. Of course, 50, 60, 70, 40, and not always associated with some kind of chronic health issues either, just coming out of nowhere. See it a lot with when there's some massive episode of immunocompromise, whether it's associated with another cold or even emotional disturbances. I was, I think I shared the story with you. There was this lady that came in and she had a lot going on, but that's why she was coming in. But when we laid out everything that was going on and all of her health issues, it was overwhelming for her, and she knew there'd have to be some serious changes. So she was up for it, but it created a lot of anxiety. What's Dr. Harrison going to put her through? Now she's going to transform her life and everything. And she built it up maybe bigger than what really was needed. And I think it was 2 days before she came in for her first appointment of care, she had this terrible shingles breakout. And it was so the stress was the catalyst for this. And I see it all the time. So if anybody ever experiences some of this and wants to know the why of it and can't pin it down to a cold or sleep deprivation, consider, is there some massive emotional burden that hit you, or things piled up? I think it's I see it all too frequently. So what are some other things? You talk about immunocompromise, but I know you were even typing this out, physical and chemical stressors. What would maybe some of those be?
As far as like physical stuff, it can be something as simple as like overtraining, right? So, I'm going to train for a marathon. I'm going to do whatever. I'm going to get in the best shape of my life, and I'm going to overdo it. And that physical stress, that stress on your physiology actually can like affect you not only metabolically but also immunologically, and then you're unable to basically keep that infection at bay. And then all of a sudden, bam, there you go, you got it. You talk about chemical stressors. We're talking about stuff where like, if you're working in industry, or if you have a really, really compromised barrier system and you become exposed to environmental toxins, whether that's from, chemicals, or it could be food, anything that basically stresses your immune system can play a part if you're having shingles, and especially recurrent shingles outbreaks.
Mm-hmm. Yeah. And I know there's a few strategies for it. Some of them are pretty potent, like the antivirals, right?
Mm-hmm.
Mm-hmm.
Yeah, I've had a couple patients that have gone on antivirals, like acyclovir is, I think, the most common one that my patients who have been on them get from their primary care physician. There's one more. Remember what it is?
No, I don't.
I
Most of them are antivirals, though.
Yeah.
Most of them antivirals.
Yep.
And they're very effective too. They're
Mm-hmm.
very effective for knocking it out. But maybe the question is, or another question of depth on this is for someone, and I've had a few, and I know you have in your clinic as well, someone who has reoccurring shingles episodes. I've seen people, in 1 year, they have like 4, 5, 6 episodes of shingles. It's like, well, this isn't normal. What's going on? Well, the first thing I want to try to investigate is what is creating immunosuppression. What does their life look like? What does their blood look like? Is their immune system weak? 99.99% of the time that it is. Something is suppressing their immune system. Maybe there's an underlying infection, or maybe all of their metabolism has been compromised. So
maybe they're going through a really stressful divorce, and there's
right.
Emotional stressors affecting their immune system. I mean, there's a lot of different environmental and physiologic and emotional concomitants that can cause this stuff. So it's really important to dive deep into like their life and kind of figure out.
That's right. If someone could be eating a great diet, but if they're not moving and they have a very, very destructive relationship at home, we're missing a big part of the story.
Yep.
So hopefully, if anybody's listening to this, we talk about immunocompromise almost every podcast in one way or another, but really evaluate your life and don't be scared to open up those doors to ask yourself the question of what's going on in my life, what's happening, what does my blood work look like? Find a doctor that's going to look at all this stuff, and don't just look at blood work, but look at everything else in your life. I think it's so important. Health is more than just blood.
You're eating a healthy diet, you're exercising, you're sleeping 9 hours a day, but you're stressed out to the max at work, or you're in a really bad relationship, or you're feeling mentally overwhelmed. That's definitely a component to it. So you have to look at all the different factors. And especially if it's recurrent, like you're having it over and over and over again, then that's something you definitely need to investigate. So,
so outside antivirals, what are some? I know we talked about a couple, I believe. What are some other avenues, maybe from the natural model of what could reduce the flare or even speed up the recovery?
Lysine. We use lysine like a lot in our practice.
Okay.
So we use that both topically, and you can ingest it also. So.
Oh, wow. Okay. Topically, I've never used actually Lysine topically.
Yep. Yep. You can get it as a cream, and you can rub, like if you do have an outbreak, you can rub it directly over it. So yeah.
Oh, wow. Good to know. See, I'm learning something every day. I know vitamin C, we'd run high dose of vitamin C for individuals as well. There's a fair bit of research between lysine and high dose vitamin C. Maybe a little disclaimer about this. If a lot of people listening to this, they are taking supplements, be careful with arginine. Arginine will inhibit lysine. So if you're taking arginine, but you have any kind of herpesviral flares, whether it's shingles or any other herpesvirus, don't go on arginine for whatever the reason, because that'll suppress your natural levels of lysine and open up that door for more and more of these flares. So, yeah, they work against each other. I think that's kind of a wrap. I think the biggest thing to know, if somebody has something like this going on, don't be scared to go to your doctor about it. Don't self-diagnose just over a podcast. But hopefully this gives you the information to kind of zero in on it. And it seems like every, a couple times a year, I have a friend or somebody reaching out to me and they're saying, oh, I've got this going on. And I'm like, okay, what does it look like? Where is it going? What part of the body? What's going on in your life? It's like, it's shingles. Like, shingles? I thought only old people got shingles. And I'm like, no.
And really stressed out, unhealthy people.
That's right.
Or healthy, stressed out people.
That's right. And
the
interesting thing is, you talked about overtraining. I had a friend that was overtraining. That's her life. And she was preparing for a big competition and running herself, too hard, literally. And that was part of her storm for this flare. But other than that, an unbelievably healthy individual. So immunosuppression can come in all forms and shapes, even if we are AKA healthy.
You're right.
Yeah.
So if you guys got value out of this podcast and you liked what you heard or watched, like we talked about previously, hit like and subscribe, turn on notifications again, share this information with your friends, family, loved ones, or anyone who you might suspect is having a shingles flare-up. Mm-hmm. And we'll continue to break this down on a weekly basis. We let these out on Monday at 5 p.m. Central Standard Time. Mm-hmm. So stay tuned, because we're going to keep rolling it out. You never know when we're going to break down what you have going on.
All right.
So until next time, buddy.
Sounds good, Dr. Kolby. I look forward to the next one.
All right. See you, bud.
Bye-bye.